Hi, I'm Denise Willis, one of the section editors for respiratory care. In this short video, I will share my top 3 favorite articles published in respiratory care in 2023. The first paper by Malin and colleagues is a quality improvement initiative to reduce unneeded screening chest radiographs in a pediatric cardiovascular ICU. Adult critical care guidelines recommend on-demand chest radiographs instead of routine screening for stable, mechanically ventilated patients, but there are not similar recommendations for children. The aim of this study was to reduce unnecessary daily screening chest x-rays by 20% in 6 months. The first step in the quality improvement process involved increasing the respiratory therapist documentation of endotracheal tube depth from every 12 to every 4 hours. Criteria were then developed for when to obtain a chest radiograph, followed by an audit process to monitor how often screening chest x-rays were performed. Following implementation of the criteria, daily screening chest x-rays were reduced by 33% during the study period, and that translated to a cost savings of $250,000. There were no increases in unplanned extubations, and there were no differences in hospital or ICU length of stay, mortality, or duration of mechanical ventilation. The reduction in routine screening x-rays not only resulted in cost savings, but also reduced exposure to radiation for both patients and staff. The next paper is Optimizing Respiratory Therapy Resources by De-implementing Low-Value Care by Fleming and others. The institution involved in this study was experiencing a staffing crisis, and they were looking for ways to decrease the workload. They identified that their practices for 3% hypertonic saline and acetylcysteine were not consistent with the AARC clinical practice guideline for effectiveness of pharmacologic airway clearance therapy in hospitalized patients. The authors developed a de-implementation process to address non-evidence-based use of these therapies. They began by collecting baseline data that was presented to stakeholders and then developed an RT-driven policy to discontinue hypertonic saline and acetylcysteine when there was not an indication per the guidelines. The policy was implemented following an education intervention, and data was collected post-implementation for comparison. Overall, the policy resulted in a 90% reduction of non-evidence-based hypertonic and acetylcysteine treatments given per month. This first control chart shows the decrease in the number of treatments post-policy, and this one shows a decrease in the number of these treatments that were ordered. There was no decrease in the number of other types of nebulized treatments. The number of full-time employees needed to deliver non-evidence-based treatments was nearly 7 FTEs before the de-implementation process began, and that decreased to around 1 per month with the policy. This study demonstrated that through education and empowering RTs that non-evidence-based therapy can be successfully reduced. My third favorite article published in 2023 was Implementation of a Respiratory Therapist-Driven Protocol for Spirometry and Asthma Education in a Pediatric Outpatient Primary Care Setting by Long and colleagues. I disclose that I am an author on this paper, but I can assure you that is not why it's one of my favorites, but rather for other reasons that I'll share. Our institution staffs RTs in outpatient clinics, including primary care clinics. Asthma education and spirometry are ordered at the discretion of the provider. We found that in our primary care clinics, these were not being ordered as often as recommended by the GINA and EPR3 guidelines for asthma management. An RT-driven protocol was developed with the goal of increasing the number of children receiving spirometry and asthma education to 80% or more. Prior to the scheduled appointment, the therapist assigned to the primary care clinic would identify children who met criteria and would then initiate the orders and discuss. In this chart, the dark shaded box represents the pre-protocol percentage of children, and the white box is post-protocol for both the spirometry and education. You can see that spirometry increased from 64 to 93% and education from 63 to 89%. And both of these measures demonstrated significant increases in the number of children receiving education and testing. This study highlights the value of the respiratory therapist in caring for the child with asthma in the outpatient setting. Each of these 3 studies were quality improvement initiatives that involved RTs or had RT-driven processes that were successful in reaching the established goals. I feel they each demonstrate the contribution and value of the respiratory therapist across different care settings in caring for both adults and children. And that is why these three articles were my favorites. Thank you for taking the time to view this video, and be sure to check out our content on our different social media platforms.